Move on to our 8:35, our weekly update on COVID-19 with Public Health Director Kathy McKay. She's okay, and Jamie, do you want to?
So maybe what I'll do while she's doing some handouts is I can talk about a couple of things that we have made some changes. Would that be okay?
Sure. Yeah, feel free to do that. Good morning.
Okay, so one of the things that we're working on, the Minnesota has the COVID vaccine connector, which has, for the first time this week, connected with local public health. And so Kathy did actually receive over 565 and over names that came to us. So yesterday, what we were able to do is actually all of those over 500 names had an email except for 10. So the 10 we called, and the ones with an email address, we were able to export and send an email and let them know that they could register for a vaccine on our website. So that was nice to make that connection with that state vaccine connector yesterday. And then the other thing we're working on too is to have a vaccine sign-up form on the on the county website. And we're hoping to finish that up with IT today. And with that, people can go and register. And so then we will able to reach out to them by email, mass email, with export in order to let them know you're eligible for a vaccine and you can register. So we would share the link with them for Prevmont for our vaccine clinics as well. So two ways, we'll get the list from the state. However, that is, most of the people on that list had been vaccinated. But then also to allow people to do that on our county website too, so they can go on. It's kind of like we call it a sign up. And so then if they're eligible for the vaccine, then we can send them an email saying, here's a link, you can register. And for anyone who can't, then they can call us. So that should be hopefully finished up today. So I thought I'll start.
So Jamie, is that sign up going to be for anybody?
It will be, so that anyone, and then what we'll do.
Within there, how will you?
They actually, there's a drop down with all of the phases and all of the descriptions in that.
And they have to kind of answer those questions, and it'll put them into their, whether they're 1C
category
or whatever.
Exactly. So that's what IT is putting in there right now, all the descriptives that they'll be able to choose which category. So then if it's 1C, then we would notify all 1Cs you're eligible to sign up now, so.
Okay. Dave?
Could you guys get that link out to us? I've got an awful lot of people who've been asking me, and I'd like to just get them hooked up to that link, particularly if it's all groups, all classes. They can at least feel like they're in line when the time comes.
Yes.
Yeah, maybe that can.
So two things, we have
IT
some.
just send that to all of the commissioners.
Yep.
Two things, we do have some clinics open right now, and so that's on the website, and we could share that, but also the link for this sign-up as well.
Mm-hmm. Right now, we're 65 and over.
As of today.
As of
Correct.
today.
K-12 and child care providers.
And higher ed's not in there yet.
The what?
Higher ed?
Higher ed is not. We've asked that question of MDH of what tier they're going to be in, and we haven't gotten a direct answer, but higher ed is not in there unless they're meeting that 65 and older.
Mm-hmm. Thanks.
So, good morning.
Morning, Kathy.
Sorry, I grabbed last week's information, and I'm sure that's not what you wanted to see, a repeat of last week, so apologize for that delay. Need some quick copies for this week. So you can see the number of active cases actually is at 120 now for this week. So we went up a little bit. During the month of February, it was 69, 46, 51. Then we jumped up at the end of, or at the first week of March to 106, and now it's 120. And I know there was some groups that were sports groups and other activity groups that there was some cases that erupted, so we have a few more cases in that regard. We have an additional death, so we are at 88 right now. And then our 14-day case rate, to note, that's up a bit. We were down in the 32, 21, 14. Now we're up. We dropped down last week. We're up again 14.97, but it's pretty consistent with our active cases, so not too alarming. The case, active cases by age, of course, the graph on that second page is going to vary based on the age group. So we do have the 20 to 24, which is still our highest now for the active cases this week, and then the 15 to 19 is another group that's consistent with the sporting events that we're noticing some spread. In the cumulative age ranges, it's still the 20 to 24 that remains of the highest age group. And then hospitalizations and deaths have been pretty consistently manageable. There's no uptick in those numbers that are alarming based on the number of active cases and things that we're seeing. I think, I'll talk about this in a minute. I think we missed a page that should have been copied. The saliva testing site is still open. We still don't have a date when that's going to end, so they continue to do the testing. Through the month of February, we've been consistent with, anywhere from 1,600 to 1,700 that are getting tested. We have a breakdown of the Minnesota residents, and the majority of those averages about 1,070 of each week that Minnesota residents get tested, and then we have like 500 to 580 of non-Minnesota residents. So most of those would be the North Dakota ones that are coming over and taking advantage of that saliva testing site. So that continues, and no word yet.
Who do you recommend should be using that site?
Well, we do recommend that for those that aren't vaccinated at this time, and they become symptomatic, you definitely should get tested because the virus is still circulating. We don't have the majority of people are not vaccinated yet. So those that are concerned about an exposure, we also recommend those that have done some travel. It's not required, but we really, especially if it's international travel, and we've had some questions about that. So some people are doing international travel, and we really recommend getting tested because you're just not sure after that travel. We've had some questions about, quarantining for a few days after travel. It's not required. So if you get tested, and then as long as you're asymptomatic, we tell people you can go back to work. You just have to, the minute you become symptomatic, you need to stay home. So those are the people we're really recommending go to the testing site if you have a concern at all, especially if you've been around, if an individual is not vaccinated and you've been around other people that aren't vaccinated, for sure, get tested. That answer your question?
I think it does, yeah.
Okay.
I guess I was asking it for others too.
Sure.
Myself.
So I'll let Jamie, before we move on to some of the other points, I'll let Jamie talk about, and maybe, did you cover that already when I was gone?
No, I just talked about the connector.
Oh, okay.
Jamie, is your microphone on?
The light is on.
Okay.
Am I standing too, or sitting too?
She has such a soft voice, she's got to be louder like I am.
Okay, so what did you want me to cover now?
Oh, did you talk about the vaccination, our clinics?
Okay, so in Clay County, basically with the vaccination administration data, we are at the total number of people with at least one dose of vaccine. We're at 17.4% of the county population as opposed to the state of Minnesota at 19.3% of the population. Total number of people with completed vaccine series is 9% in Clay County and 10.6 statewide in Minnesota. And then people aged 50 to 64 with at least one dose of vaccine, 20.2% in Minnesota, 20.2 in Clay County and 17.3 in Minnesota. And then people aged 65 with at least one dose of vaccine, we're at 64.8 in Clay County and 65.9% in Minnesota. And the goal for the governor of Minnesota is 70% before moving to the next phase. Excuse me. And then the cumulative number of doses by Clay County Public Health only is 6,888. And then you've got the graph of our weekly doses down at the bottom. And then just to let you know, for this last week was a challenge for most of the counties and providers because we are getting to be pretty saturated with that 65 and over population that have not been vaccinated. And so we did do less doses, but we had the opportunity with providers and public health to move vaccines. So people were getting it where it was needed. So a lot of that shifting was going on. So because of that, and still being in that 65 plus, and our schools are done, our childcare is done, and our healthcare providers, except for a few that we are continuing to invite. So with that, we did reduce less doses, with the comment that if they open it up, we'd like to receive more. But otherwise, we would have to focus on that population. So we will be this week giving just 500 first doses. And then we have 400 second doses. So that's quite down for us for this week compared to what we've been doing. And do you want me to talk about this?
Oh, sure.
Okay. So last week, we kind of did an introductory to the phases that the governor of Minnesota has shared. And this, one of the attachments in your packet is a more detailed kind of spell out of that. We're hearing that based on the challenges last week that there would be a potential for opening up to the next level. So this shows, with phase 1B, tier 1, which is where we are right now with our child care and schools and 65 plus, then moving into phase 1B, tier 2. And that's where we would really be focusing primarily on those that have health conditions, and it's very spelled out in here. The Commissioner of Health mentioned yesterday that those are individuals that are very well connected to their healthcare providers and anticipating that they'll move through that group real quickly because of that. And then also, we talked a little bit about manufacturing and food processing, and that would be a group that we would be working with the essential workers at the same time. And then phase 3 is where we move into the older individuals, 45 to 64, with one or more underlying medical conditions. And then also people aged 16 to 18, or 18 to 44 with 2 or more underlying conditions, and those two. And when we talked about that sign-up sheet, that's exactly what's dropping down, the details of that. And then moving into tier C is, and this is guidance from the CDC and what MDH is looking at, that we continue to try to focus on those with chronic health conditions, as we will be doing both, just like we did, healthcare workers at the same time that we were doing nursing home and assisted living individuals that were most at risk for complications from the virus if they were ill. We will be doing that same kind of prioritizing those with chronic health conditions primarily. And then we go into the tier 4, and then eventually to 1C and general population. The one message is that we are moving quicker than anticipated, so hopefully there will be plenty of vaccine and opportunities for people throughout the community to receive that vaccine.
Mr. Chair.
Who has a question? Oh, Jenny, go ahead.
Thank you. I did see that there's a press conference this morning and that the governor is anticipating opening it up to that next phase tomorrow. Have you heard that?
We have. I just didn't know if we were able to share that.
Sorry.
No.
My next question would be, what is our threshold for capacity in terms of administering vaccinations? I see that we've got 900 this week, and we've had more or less staff-wise. What is your capacity?
And sorry, Kathy.
No, go ahead. No, that's fine.
We are in the process of working with HR to bring on some people to help us with vaccinating, just simply for that process. Our staff, our nurses are doing a lot of the vaccinating. However, we do have a lot of the students from the universities around us who are assisting us. But what we do on a weekly basis is we report to the state health department on what our capacity is. And the most we've asked for has been 1,700 in a week because of the fact that we've got that 72-hour turnaround time. And so that's really what's causing the limitations for us, is that 72-hour turnaround time.
So the site that you use is capable of handling 1,700 a week in terms of just the logistics and,
Yeah,
okay, so that's been working good.
that's been working very well, yes.
Commissioner Mojo, do you have any other questions?
Yeah, and my follow-up would just be, as a county board, is there anything, as we look forward to the possibility of getting more as the availability becomes, what do you need from us in order to vaccinate more people?
Well, it'll be helpful once we finish the onboarding of all of the nurses that have applied to assist us. Some of them are very limited because they have jobs elsewhere, so they've offered to assist maybe in the later part of the day or on the weekends. So I think that capacity, as we onboard we're starting with the RNs. We also have LPNs that have applied, so we can utilize those as well. So that will be extremely helpful in being able to get that vaccine out, and then to give our nurses a little bit of relief so they can keep up with their other obligations. The site is great right now. We potentially don't know what the needs will be with the city and with that YEMCOM site. So right now it's working well. We're able to get people through there, and the setup is really nice. So maybe in the future we'll have to, keeping our eyes open if there's a need when they open up that building, if we'll need to move if we aren't quite done with our vaccination process, especially when we open it up to all the general public. So, that might be something we'll continue to look at, and then we'll work with the city about the length of time that we can utilize that site. I talked with the city manager yesterday, but I don't have a time frame yet about what they're thinking they'll need that site, where we'll need to leave. So right now there's nothing imminent for that. I did also reach out to some of our legislators. The reality is this requirement by the governor, and maybe he'll change it today, we don't know, but the requirement from the governor for a 72-hour getting the vaccine out by the time we receive it, and then in 72 hours, is really a burdensome for our citizens, and also for us. We can't get the vaccine until Tuesday, so Monday is a wasted day. We can't get vaccine out because we can't carry it over until Monday, so we have to have all the vaccine out by Friday, and that's very challenging for people that are working or having commitments to get them in to get this vaccine. So I reached out to the legislators to see if they could encourage the governor to expand that. I understand when we started that, the rollout was a bit delayed, and there was a little bit of burden, but we're at a point now where I think even if we had a 7-day requirement to get vaccine out, it would be much better for all of the people. And I'm not speaking just for Clay County, I'm speaking for the whole public health agencies across the state, because we've all expressed this concern that this 3-day limitation is really challenging. So, so I'm hoping that maybe that will change. We'll see. There's a number of people reaching out to legislators to express to the governor it would be nice at this point to a 7-day turnaround time should be adequate.
Commissioner Mojo, do you have any follow-ups? Okay. I want to.
No, thank you.
Thank you. In terms of the national discussion that I see, there's discussion now that there's going to be enough vaccine for all adults in this country by the end of May. Just doing the math, that's not very far away. Mm-hmm. And if that indeed happens, and it becomes available, if we have the opportunity to get into more of a mass inoculation type of deal, I think we should be ready for that. And I don't know what your plans are currently. I do know that right now within the bill that's been passed through both the House and Senate. It's back at the House right now. There's significant dollars, and I'm a little confused, and Steve, this is something to follow up on, but there's dollars that are set aside for counties and city governments. But I also noticed in that pie chart, there was a separate amount for vaccination. So, but now I saw that some discussion was that the amount that might come to the counties, the vaccination dollars are included in that. So I'm a little, I think there's going to be some clarification there, but I don't think we should be afraid to make whatever plans that you need to do. Because certainly the funding is going to be there to make sure that we can accomplish this. And if we have 30,000 vaccines become available for Clay County, I'd like to see us ramp that up.
Right.
And get it out, and we should be ready. And I think from our standpoint, right now, and this goes to what Commissioner Mojo said, what can the county do? I think what we need to do is tell you right now that make your plans and we'll back you.
Okay.
I think that's the important part message that we have to give right now. And I do want to say I got in and had my second shot, and everything that you guys do over there is tremendous. And I want to just, on behalf of our board, make sure that you relate to all those people that are working over there and these part-time nurses that are coming in. Make sure you tell them thank you. I happen to recognize a few of them when I went for my shot, and it was just nice to see that you have that support. And you might need a lot more. I'm hoping that you will need a lot more to get this done. So, and then just back on these numbers, when we talk about the 6,808, and these percentages that you talk about, percentages of 65 and older being at 64.8% in Clay County. Are those percentages based just on vaccines provided by the county?
No, those are.
Or is that everybody?
That's everyone.
So whether they got it through Sanford, Essentia, or pharmacy, those percentages, that includes them all?
That's correct.
Okay, all right. I was curious about that.
Yep.
But the 6,888, those are just county
Correct.
Just public health.
distributions? Okay.
That's correct. Yep.
All right.
And then did you talk about the new guidance? The Center for Disease Control has some new guidance that you may have heard, it's already out there, about fully vaccinated people can now visit with other fully vaccinated people without wearing masks or physical distancing, another household. And I'm not sure if in our haste, did you get did you get this on your handout? So it kind of shows that the changes. And then fully vaccinated household visiting with another household who is at low risk for severe COVID disease can also connect without prevention methods, so no masking and social distancing. So those are the big changes. Refraining from quarantine and testing following a known exposure if you're asymptomatic. So if you're fully vaccinated, you don't have to quarantine or test if you've been exposed as long as you have no symptoms. So that's another big change that the CDC had just, they just put that out yesterday. And so, but fully vaccinated people should continue to, when they're in public, you still need to wear your masks, social distance. And if you're with unvaccinated people from multiple households, you're still required to wear your mask. That continues to be the same. Avoiding the medium and large size gatherings, and get tested if you're symptomatic, experiencing COVID symptoms. So a few changes at least that's been interesting that the CDC has has decided to make that change. So we still know that the COVID vaccines are effective for preventing illness and death. So we know that. We're still not sure how effective they are against the variant strains. They're still researching that. They're still working on how effective is this specifically against those variants. And we're still learning about how well COVID vaccines keep people from spreading this disease. So that's another thing that they're still working on that data. And we're still learning how long the COVID vaccine will be effective. So how long will that be effective to protect people? So there's still some unknowns that the researchers are still working on, but this is a positive thing that after research that they've decided if you're fully vaccinated, you can connect with others that are fully vaccinated. You are not fully immune until, of course, 2 weeks following your second vaccination. We don't have Johnson & Johnson vaccine yet, so the two we still are working with is Moderna and Pfizer, and those are the 2-dose. So you're not fully vaccinated or fully immune until that 2 weeks after the second dose. We don't know when we'll get Johnson & Johnson. We have a request in for it, but that's still an unknown. Any questions about the CDC?
Commissioner Kaylee.
I have a question about the vaccines. Can you talk about the difference between how the Pfizer and Moderna vaccine work and how the Johnson & Johnson vaccine works? As far as one is, the mRNA is Pfizer and Moderna, and then the Johnson & Johnson is, what is that word? A vector vaccine, is that what that's called?
I don't know if we have all of that information specifically that you may be asking. What they're recommending, of course, and this is out there, is get the vaccine that's available. The Moderna and the Pfizer are up to 95% effective after that second dose. The Johnson & Johnson is a little less after the first dose. It's a little less effective.
Only dose.
Yeah, the 1 dose, sorry, the Johnson & Johnson 1 dose is a little less effective, but still highly effective against illness and death, so the severe illness and death. I'm not sure the side effects for Johnson & Johnson, they're saying are pretty close to what we're seeing with Moderna and Pfizer. That, you know, there's a wide variant of people that have fever, chills, headache, body aches. Some get it from the first dose of Moderna and Pfizer, some get it from the second dose. Some are pretty significant, other people have less effects, and so it varies. The sore arm is pretty common. Johnson & Johnson, apparently, the people that have received it are experiencing some of the same effects of that. But I don't have the specifics on what you're asking. But we can get that information for you.
Probably not a huge priority, as we don't have it in the area anyway.
Yeah, I think the critical piece is to get what's available to you.
Right, and there is, I've read some things about how Johnson & Johnson has been exposed to some of these variants in these tests, so that could be one of the reasons why it's showing a slightly lower efficacy. But since it has been exposed to those variants, it's still highly beneficial, so.
Yes, absolutely.
One question. Some people I know I've talked to, they've taken the first shot and they've gotten fairly ill from it, so they're not planning on taking the second shot. Is that, what's your advice to them? Is that take it, or?
You know, if there's some real significant, you know, we talk about an anaphylactic reaction, which is different than some of the responses that they are, you know, they're getting the headache, the fever, body aches, chills, which is, you know, it's not fun to go through, experiencing that 24 to even 48 hours afterwards. If there's a concern if they should take their second dose, we really recommend they reach out to their provider if they think there may be a reason not to receive that, but just know that it is pretty common to get some of these side effects. So I know people are concerned when they get side effects from the first dose. So if you have some health concerns and really are concerned, we recommend that you get the second dose, because again, only after the first dose, you're about 50% protected, which isn't giving you enough immunity. So if you can get that second dose at all, that's really what we recommend that people do. But if they feel like there may be a concern with conditions that they may already have, they really should reach out to their healthcare provider. Some people, we've recommended them to do that, just to get confirmation that they don't feel uncomfortable getting that second dose because their physician or nurse practitioner recommended them to continue that. But there are some conditions, I know of only one throughout all of this where the physician really recommended not to get that second dose, but that person had a pretty significant reaction. Does that help?
One last question that I have, and I'm asking it for a friend. Once you've been vaccinated, can you test positive for COVID?
Once you've had the dose,
Yeah, once you've gotten the vaccine, can you test positive for COVID?
you know.
From the vaccine itself?
Oh, I'm not aware of, because the recommendations are you really don't need to get tested and probably shouldn't get tested once you've had the 2 doses
Well,
of
but there's
vaccine.
times when you have to, for example.
Well, if you're symptomatic,
Well, or if you travel to
that's true.
another
Yep.
country. You may have been vaccinated when you left, and in order to come back, you still have to be tested. And so that's where the question came from. Can you test positive after being vaccinated from the vaccine itself?
That is a good question. I'm not sure about the answer to that.
Okay, that's another one you can look into.
We'll have to look that up. Yeah, I wasn't,
So when so even when our commissioner here decides he's gonna go to Hawaii, which is kind of.
not to point him out, but.
Does he need to be tested, and will it keep him over there for a while?
I think,
Oh, I hope.
I think he has to stay there a couple months in quarantine. We will definitely find out the answer to those questions.
No, I literally am asking that for
Sure.
somebody else who's.
Absolutely. We'll get that information out, and we can even post it as well.
Okay.
Because I'm not quite positive about if you're tested positive, if you have the 2 doses, so.
I know that people who had COVID for a certain period of time, they can still test positive because of antibodies or something, but,
right.
so.
Question.
That's very good.
Okay.
We'll research that. We'll get our experts on that and find out.
Once again, thank you both, and
Thank you
thank
very
all
much.
of your staff for all the continued good work that's being done. Clay County we're proud of our public health department here, so.
Thank you very much. Appreciate that.
Thank you.